I live and work in my community. I see patients, I see people that are very needy for appropriate health care services in the local grocery stores. I see them in the local house of pizza. I see them in the local bank. I mean, they may not know what I do, but they know I'm in healthcare. And so they want to know, why can't I have access to this? Via telehealth is about the only way that a lot of these residents are actually going to get care.
The South Carolina Telehealth Alliance is a collection of organizations who are banded together to further disseminate telehealth throughout the state. The founding organizations were brought together by the state legislature, and it was their intent to develop telehealth in a collaborative atmosphere. And so some of the key stakeholders from the beginning who were forming telehealth in our state in a grassroots effort were put together in a formalized manner under a strategic plan that created the South Carolina Telehealth Alliance. So in the South Carolina Telehealth Alliance, we collectively work to develop our telehealth services and disseminate them, but we get together and we do strategic planning together to try to make our efforts align. And when we do a strategic plan, we then use the advisory council to oversee some of that plan throughout the year to disseminate it. State funding comes down from the state to the Medical University of South Carolina and is then deployed to the different entities that are partnered in the Telehealth Alliance. And so each one of those entities has a job to do that aligns with the strategic plan that is put together.
We talk about strategy mostly, but we talk about the challenges in the state, unique to each region. Upstate, Midlands, PD, Low Country, we all have different challenges that we face as we try to implement different programs and deploy different technologies. But I think we're overcoming a lot of the barriers and challenges through collaboration.
Telehealth is growing all across the country. There's at least 200 telehealth networks across the country, so there's more networks than there are states by far. So a lot of creation of telehealth is happening out of need, and because it's happening anyway, so people are trying to coordinate these efforts. But this specific one in South Carolina, being charged by the state legislature, is really about developing it so that it is purposefully designed to meet the needs of the state's hospitals, citizens, clinics. What that means is sometimes a work in progress, and that we do the best by putting our minds together.
I think that every community in this state and probably all over the country have passionate folks who are not only interested in themselves, but they're interested in the people around them. Our Telehealth Alliance advisory group is a strong leadership group.
The most rewarding part of working the South Carolina Telehealth Alliance is the chance to do something good for our state, and the energy that people bring to the table and how much people believe in this.